Norethindrone Ac, Lupaneta, is a medication used to treat women with abnormal bleeding from the uterus. It can also be used for women who have stopped having menstrual periods for several months, but are not pregnant or going through menopause. Additionally, it is used to treat endometriosis, a condition in which tissue that normally lines the inside of the uterus is found outside the uterus in the abdomen/pelvic area, causing painful/irregular periods. Norethindrone is a type of hormone called progestin, similar to the hormone progesterone that the body naturally makes. This medication works by stopping the normal growth of the uterus lining during the menstrual cycle and signaling hormone changes in the uterus to restore normal menstrual periods. It's important to note that this medication should not be used to test for pregnancy. Additionally, progestins are not effective in preventing miscarriages. As for the daily dosage and optimal timing, it's best to follow the instructions given by your healthcare provider. Be sure to take the medication at the same time each day to maintain its effectiveness. Before taking Norethindrone Ac, Lupaneta, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth as directed by your doctor, with or without food to prevent stomach upset. The dosage will depend on your medical condition and how you respond to the treatment. If you are taking this medication to treat stopped menstrual periods or abnormal bleeding from the uterus, your doctor will typically prescribe it once daily for 5 to 10 days during the second half of your planned menstrual cycle. You can expect withdrawal bleeding to occur within 3 to 7 days after you stop taking the medication. If you have any questions about the dosing schedule or how to take this medication, be sure to ask your doctor. And don't forget to inform your doctor if your condition persists or worsens. Side effects of Norethindrone Ac, Lupaneta, may include nausea, vomiting, headache, dizziness, mood swings, trouble sleeping, weight changes, acne, breast swelling/tenderness, changes in sexual interest, unwanted hair growth, or hair loss. If any of these effects persist or worsen, contact your doctor or pharmacist. Remember, your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, seek immediate medical attention if you experience any serious side effects, such as changes in vaginal bleeding, changes in vaginal discharge, depression, swelling of the hands/feet, frequent/burning/painful urination, yellowing eyes/skin, or dark patches on the skin or face. Additionally, this medication, especially when used with an estrogen product, may rarely cause very serious problems from blood clots. Seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, weakness on one side of the body, trouble speaking, sudden vision changes, confusion, severe headache, severe dizziness, fainting, trouble breathing, coughing up blood, or pain/swelling/weakness of the arms/legs. Although a serious allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects not listed here, contact your doctor or pharmacist. Before taking Norethindrone, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss this with your pharmacist for more details. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have a history of certain medical conditions. These include vaginal bleeding of unknown cause, bleeding in the brain, a loss of pregnancy with some tissue remaining in the uterus, family history of certain medical conditions, obesity, heart disease, high blood pressure, cancer, blood clots, lupus, seizures, migraine headaches, asthma, liver disease, kidney problems, high blood levels of cholesterol/fats, depression, diabetes, strokes, and if you smoke. This medication may cause dizziness, and the use of alcohol or marijuana can make this effect worse. It is important to avoid activities that require alertness until you can do them safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, it's important to discuss this with your doctor. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Norethindrone may cause dark areas on your face and skin, and sunlight can worsen this effect. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. This medication should not be used during pregnancy. If you become pregnant or think you may be pregnant, inform your doctor right away. Norethindrone passes into breast milk, so it's important to consult your doctor before breastfeeding if you are taking this medication. It's important to be aware of potential drug interactions with norethindrone, as they can affect how the medication works and may increase the risk of serious side effects. Be sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without consulting your doctor. There are several medications that can affect the removal of norethindrone from your body, including azole antifungals, rifamycins, St. John's wort, and drugs used to treat seizures. It's important to inform your doctor if you're taking any of these medications. It's also important to note that norethindrone may interfere with certain lab tests, which could potentially cause false results. Make sure to inform the lab personnel and all your doctors that you are taking this medication. If someone takes too much Norethindrone Ac, Lupaneta, and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting. It's important not to share this medication with anyone else. It's crucial to have regular physical exams, including lab and/or medical tests like blood pressure, breast exam, pelvic exam, and pap smear while taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. Make sure to keep all medical and lab appointments. Don't hesitate to consult your doctor for more details. If you forget to take a dose of Norethindrone Ac, Lupaneta, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Norethindrone Ac, Lupaneta, at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need it or it's expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.